So, welcome to this interview program, a special interview, and we just give you an invitation to listen to this wonderful interview, well organized and produced by DISHARC Media and Communications. As usual, I'm Michael Chung, and here I'm sitting in our own studio, and I'm just going to talk to one famous lady doctor from Toronto. Well, before I just reveal the secrets, I'd like to introduce Dr Irene Lara Corrales.
Good.
Did I pronounce your name
Perfectly
correctly?
well.
And Dr Irene Lara Corrales, she is an assistant professor at the Department of Pediatrics, University of Toronto, staff physician, Hospital for Sick Children. So, Dr. Irene Lara Corrales, first of all, tell me about your profession in Toronto. Although I've mentioned something already.
So I'm originally from Costa Rica. So I did my medical school and my pediatric training back in Costa Rica. And I came to Toronto in 2005 to complete further training in pediatric dermatology. So I did a clinical fellowship in pediatric dermatology there for 3 years. During that time, I also started a master's degree at the University of Toronto. And I extended to complete my master's degree through a kind of research fellowship also in pediatric dermatology. So after I had done all this training, I ended up being hired by the Hospital for Sick Children and the University of Toronto to stay there and work in the pediatric dermatology field at the Hospital for Sick Children.
And you did your earlier training in Costa Rica itself.
Yes, yeah.
Can you tell us something about it?
Of course. Like I'm Costa Rican and now Canadian as well, so we're able to have the dual citizenship. Costa Rica has a very good health system. We have social security for all Costa Ricans. I trained at the University of Costa Rica, that is also a very well-recognized university all through Latin America. And I did my medical school there and my pediatric residency at the Children's Hospital in San Jose, Costa Rica as well. It's a very clinical program. We may not have a lot of resources, but we do a great job with our clinical work, diagnosing and seeing patients from all over Costa Rica.
Now I'm becoming a little bit inquisitive.
Of course.
And that is, why did you leave Costa Rica and why did you go to Canada?
So my initial plan was to complete my 2-year fellowship and go back to Costa Rica. Things kind of started adding up and I started studying more, and by the time that I had completed all this training, they offered me a job. So it was a very hard decision. All my family is back home in Costa Rica, but I was in Toronto with my husband and at that time 2 of my kids. And we had all adapted very well in Toronto. So I think because the kids had adapted so well, my husband already had a very good job and I was very happy at the hospital. It ended up being an easy decision to make because what I was able to do there, the research, the education and the clinical work, I don't think I would have been able to do it in the same level going back to Costa Rica.
Okay, now you have already revealed the secrets. Why you just left Costa Rica and why you then chose Toronto, Canada.
Yeah, some secrets. I'm not revealing all.
Please don't reveal the secrets. Maybe there are many secrets. Certainly you have got your right to secrecy. But the thing is, now compared to the medical system of Costa Rica and Canada, are there huge differences or I just don't know whether...
I think I've been very lucky because both the health system of Costa Rica and the health system of Canada are amazing health systems. So in Canada, the health system in Canada is there's no private medicine, so all is run by the government. So everybody has access to healthcare as well. In Costa Rica, there's a mixed. So there is public system, but there's also private sector. So it's kind of a balance. But the health system in Canada, it's amazing. Like it's very high level and everybody has access to it. So I think I've been very lucky in my career because the two places where I have worked have amazing health systems.
So now, tell us something about the activities, your particular activities in the hospital there in Toronto.
Sure. So as a pediatric dermatologist, I just see children that have skin problems. So skin problems in children are quite unique. Children are not little adults. So things that are seen in adults are not necessarily the same and might not be necessarily treated the same in children. So the training that I was able to obtain helps me deal with what I do now. I see lots of genetic disorders. So many of the things that we see in little children are inherited. Some of these conditions are chronic, lifelong diseases that we manage. In children, we see many infectious diseases as well, many inflammatory conditions. There's kind of a whole spectrum of disease that we see. I run general pediatric dermatology clinics, but I also have some specialty clinics. So genodermatosis or genetic disorders that have skin manifestations. We run a clinic joined with genetics that we see patients together. Many of our clinics are multidisciplinary, like we see patients and in the same encounter, the patient not only sees us as the dermatology team, but they might see other services as well.
It's very interesting that you are saying, you're talking about the genetic transfer of the children, what you have to do with dermatology among children. What are the main types of diseases prevalent in children, by the way?
There are common ones and there are other not so common ones. So now we know that many, there might be a predisposition, a genetic predisposition for many inflammatory diseases. So for example, if my parents have psoriasis or eczema, I am probably more likely to have it. So that has kind of a genetic predisposition. And then there are other diseases that might happen for the first time in a child because there's a spelling mistake in their genes. So for example, we see many patients with neurofibromatosis type 1, epidermolysis bullosa, ichthyosis. Like there are so many names and so many different syndromes and genetic disorders that are, many of them are primarily seen for the first time or diagnosed in children. So we're exposed to many of those conditions.
It's also nice to hear, Dr. Irene Lara Corrales talking about the various types of diseases and her medical career and her postings and her achievements, studies, and so on. Yes, Dr. Irene Lara Corrales, you must have been very tired working in the hospital for a year, or you must be very tired. Then you chose this beautiful country of ours to spend your holidays.
Well, this is not really holidays. I'm still working. This is kind of part of my academic time. So I'm lucky that our institution also allows us to have academic activities. And this one definitely fits into one of my academic activities. So I'm getting to know Nepal in my free days, but I'm still working hard the rest of the days.
I was simply trying to make a little bit of story out of a visit.
Okay.
To dig out more information.
Of course,
from you.
yeah.
I hope you didn't mind it.
No, not at all.
Well, then you came to Nepal and
Yes.
then you've been visiting different medical institutions.
Yes.
Can you tell us something about that?
Of course. So this is a project that in kind of part of my pediatric dermatology career, I'm part of the Society for Pediatric Dermatology. So the Society for Pediatric Dermatology has members from all over the world. And probably about a year and a half ago, we got an email letting us know about the project and asking for volunteers to come to Nepal. So Dr. Neil Prose, one of the senior members of the Society for Pediatric Dermatology, had been approached for many members of the society because we wanted to find ways of volunteering and doing some volunteering work in low to middle income countries. So his contact with Dr. Zhao basically kind of started. Those were the first steps towards this program. Health Volunteer Overseas kind of partnered with the Society for Pediatric Dermatology to put this, make it a little bit more formal. And that is kind of the way that I got introduced to the program. And then I applied to come and volunteer my time here.
So you have been taken from one place to the other?
So yes, I've been kind of going to KMC, NMC, and DISHARC, so a little bit around. We've also done a little bit of, I think they call them clinics here, so visits to an orphanage and also to the Yellow Mamba, that there's also a project there. So I've been a little bit around.
So during this round which you did, you must have really collected some sort of impressions.
Of course.
Or maybe some of the comments you'd like to make. Do you want to say something on that? Something about the impressions you have gathered?
So I'm learning a lot as well. Like I find that you have great doctors doing great work. The skin disease that I see back in Toronto, like I'm seeing some of them here. I'm seeing other things that are different. I think pediatric skin problems, some of them we're going to be seeing all over the world, and now probably with travel, like the world has become small in that sense, like we're seeing many of the same things. There are definitely differences in how we treat. Definitely in Canada, you need to have a prescription to be able to get some of the medications that here what I've seen is that you can get them just if you go to a pharmacy and you tell them some of your symptoms, you get medication. So that changes the way some of the skin disease is presenting. So by the
That's
time...
harmful, you mean?
I don't know if I would go that far to call it harmful. It just changes the way that the skin changes present. So there might be a little bit more challenge arriving to the right diagnosis.
Sorry, it's not the right way of medical path.
Well, I think like the way that I train, like I've seen things done differently. Definitely when there are ways of getting medications, if you don't need a prescription, I'm sure that sometimes it might be the right medication and it works, but it's probably not the right path or the path that I would advise to follow. Having a right diagnosis is key for the treatment to work, and if you get the wrong medication for a skin disorder, it might sometimes even make it worse.
So I dare not come to your pharmacy in Toronto asking for Dr. Irene.
Well, if they go to the pharmacy
and say,
they'll probably...
I'm from Nepal, please give me this medicine.
Nobody will. They
that.
won't get the medication.
All right, now we'll take you to the classes, to your interactions with the people there. And here too, you had a class, right? You spoke to many doctors around.
Yeah, so I was able to. Yeah,
that?
of course, I was able to give a lecture. I tried to. I called it diagnostic dilemmas in pediatric dermatology, just to kind of be able to incorporate many different things. Trying to give a little bit of different pearls for managing and diagnosing different skin disorders. I've also been in contact with a lot of the residents, so I've been doing a lot of teaching, like informal teaching in between patients, or I've been carrying my iPad around, so sometimes I just pull out a little presentation that I've made before and show them some of the slides. So it's been I really enjoy teaching, and the residents here are very keen to learn. So they have been not only very attentive, but also very inquisitive and asking lots of questions about different skin disorders in children.
Yeah, it is something like this also, that you didn't have time to go around well, not only in Kathmandu, you were just busy here and there. If you would have gone to other places, villages and so on, that would have, presented a different kind of scenario.
Of course.
Where you could really gather more information on that.
Yeah.
Naturally, a doctor knows many things in advance, and he or she already knows the perils and the dangers of skin diseases and so on. And now we come to the final, because we won't take too much of your time. So, what is the message you have got for DISHARC? You want to say something?
Well, I think I think DISHARC has a great mission. I think it is very important to have the right training to be able to accomplish that mission. Definitely having further training and further education in pediatric dermatology is going to help them grow this field. I think once you have that exposure for a year or two dealing and seeing skin disease in children, by reading around cases, reading books, being like searching the literature, seeing what the new research is showing, all those things are important to be able to manage and diagnose patients correctly and manage them as well.
So certainly this suggestion of yours will be taken seriously by DISHARC, this I can promise you. And through this projection of this interview, we will also come to know that what homework we have got to do, what homework DISHARC has to do. Well, I thank you very much for being with us. We wish you a safe journey, bon voyage, like
thank you so much.
People say, and then thanks for coming and for giving us a precious time.
For sure.
Thank you very much. So there you are. I just spoke to Dr. Irene Lara Corrales, Associate Professor of the University of Toronto and specializing in the field of pediatrics dermatology and more so on child dermatology, with a lot of information and then also expertise and experience. Hope she's coming back to this country next time with better ideas and better suggestions. That's all for today.